I'm Miss Pollard, and I'm from Medico, and of course we're here to implement the new EHR and PHR system. To my right is
Shana Nichols, Psych P.
Shonda Yates, labor and delivery nurse.
Elizabeth, triage nurse.
and we're here to introduce you to the system that your company has decided to implement in order to make your jobs better. And to my left is my colleague Elizabeth, who will be discussing the objectives of today. It will be followed by a demonstration of how to implement the system.
Today we are going to touch up on 5 main points. The first point will be the benefit of electronic health record in a big picture. And secondly, we are going to talk about how electronic health record will be utilized in patient care. Thirdly, we are going to talk about how the nurses will be utilizing electronic health record. And fourthly, we are going to discuss about the privacy and confidentiality of the patient's information. Lastly, we are going to talk about how the system will be implemented.
My name is Elizabeth. I'm going to be your nurse today. Could you please verify your date and birth for me?
My name is Miss Johnson. My birthday was 9/7.
Okay. Thank you, Miss Johnson. Miss Johnson, it's time for your medication. And before I give you the medication, is there any other medication you're taking?
Yes, I take this brown white pill, but I don't remember the name of it.
Okay, let's see. I have an app called Hippocrates on my phone, and it can help us find the pill you're talking about. Is this the pill you're talking about?
Yes, ma'am.
Okay, good, yeah. So, yeah, this pill is a beta blocker, and since you have high blood pressure, it's going to help lower your blood pressure, okay?
How many times as a nurse have you been overwhelmed with loads of documents and papers and files that you have to review for patient care? I've been faced with this dilemma many times, and there is a better solution. Electronic health records are the solutions to the problems of all the multiple paperwork. It allows nurses the access to log into a site to look at all of the patient records just with the click of a button.
Nurse showing that this is a prescription for Miss Johnson, okay? Go ahead and process it.
I can't even read this. I'm going to look it up on the electronic file. So that way I can know exactly what medication the patient is prescribed and not having to translate anything that I can't understand. That's one of the benefits of EHR. You're able to access patient information at any given time, including medications that physicians have prescribed for their patients.
My name is Elizabeth, and I'm going to give you your med today, okay?
Okay.
All right. So can I please verify your name and date of birth?
Ahmed Salukiola, 1772.
Okay, good. So Ahmed, I have a blood pressure med for you. Let me scan your wristband. Okay. The system is asking me to get your blood pressure and your pulse, okay?
Oh, okay.
And this is to reduce the risk of medical errors. Your blood pressure is 165/85. All right, and your pulse is 80.
Oh, okay.
So
I was here 2 weeks ago, and the nurse did take my vitals then. By any chance, could you pull up those numbers?
oh, sure. That's one of the benefits of the electronic health record. It keeps track of the patient's information, okay? I see. Oh, yeah. Your blood pressure was 165/70. Okay?
Oh, okay.
All right.
Thank you.
I'm not feeling well.
You're not feeling too well today? Okay, so I'm Dr. Nichols. I'm going to find out why you're having this abdominal upset. Okay. Well, we would have access to that information. However, we need you to sign a confidentiality agreement form before we can even access it. Is that okay with you?
Yes, ma'am.
Okay, please sign.
This is some new stuff.
Yes, this is new technology for the EHR. We are able to access Mrs. Johnson's information since she signed the confidentiality agreement. We have to have the username and password in order to access any information. So I am able to see Mrs. Johnson's past medical history here on the PHR. It is very useful and helpful to us as healthcare providers for efficient care and fast care.
Throughout this presentation, you have received information on how EHR and PHR provides for adequate health care delivery and improved quality of care and enhances patient safety. EHR and PHR complies with all government regulatory mandates. It improves information accuracy, eliminates lost and misplaced documents, and provides for security, privacy, and protection of health information. Electronic information is power, and we have the power. Thank you all for your time and your attention.